This program is hosted by Caring Rehabilitation. This time I will talk about multifidus exercises that can be performed in the supine position. The bird dog exercise, a multifidus (LM) exercise, is performed on all fours as the basic limb position. Patients with knee pain due to osteoarthritis and those with artificial knee joints have difficulty performing the kneeling position. Here are the multifidus exercises that can be performed in the supine position, which can be executed by people who are unable to get on all fours. There are several pieces of sports equipment for stretching and balance training, as shown in the figure. The upper apparatus consists of two tubes made of sponge and is held together with a rubber band. The lower apparatus has a semi-cylindrical shape and is made of foam plastic with solid strength. The patient was placed in a supine position, head to hip on the device. Place the patient's feet shoulder width apart on the floor. Next, raise and hold both hands toward the ceiling. This is the basic limb position. In this position, the upper body is unstable. From this basic limb position, horizontal abduction of one of the upper limbs is performed. Stop when the person's hands do not touch the floor. Then, hold this position for 10 seconds and return to the basic limb position. Next, move the opposite upper limb in the same way. Do not let your body fall off the equipment or place your hands on the floor during the movement. The goal is to hold each side for 10 seconds for 10 times. Holding a weight in the hand increases the activity of the multifidus. Please see the figure. He is holding a dead weight in his hand. The muscle activity of the multifidus is proportional to the weight of this weight. This graph shows the percent MVIC, maximum voluntary isometric contraction, derived from muscle potentials from the multifidus as the local muscle and the lumbar iliac crest fibers, ICLT, as the global muscle. This is an indication of what percentage of the maximum muscle strength the person is exerting. The weight in the hand indicates no weight for NW, no weight, 1 kg for 1W, and 2 kg for 2W. As the weight load held in the hand increased from NW to 1W and then to 2W, the muscle activity of the local muscle LM and the global muscle ICLT increased. An important concept in back pain prevention exercises is to activate the local muscles without activating the global muscles too much. There is an index called the L-G ratio. The L-G ratio is the percent MVIC of the local muscle divided by the percent MVIC of the global muscle. In other words, it is the degree of muscle activity of the local muscle divided by the degree of muscle activity of the global muscle. If this value is large, selective muscle activity in the local muscle is high. And if it is small, selective muscle activity is low. Now let's look at the L-G ratio. This graph shows the L-G ratio for the supine multifidus exercise. I'll say it again. If this value is large, the selective muscle activity of the local muscle LM is high, and if it is small, the selective muscle activity is low. In one study, the L-G ratio of bird dogs was 2.5 plus or minus 1.6. NW, 1W, and 2W all have similar L-G ratios, suggesting that the selective activity of the local muscle LM is equivalent to that of the bird dog exercise. While maintaining the L-G ratio, the muscle activity of the multifidus muscle increases in proportion to the weight of the weights in the hands. So it is recommended to perform without weights at first and gradually increase the weight of the weights. The supine multifidus exercise is a multifidus selective activation exercise that has the same effect as the bird dog exercise. In people with lower back pain, extending the hip joint often causes the pelvis to tilt forward, resulting in pain. For such people, it is recommended to place a platform under the feet to reduce hip extension and reduce the forward tilt of the pelvis. In this presentation, I have introduced multifidus exercises that can be performed in the supine position. With this exercise, people with painful knees or artificial knee joints can perform multifidus exercises without difficulty. Please do your best.